Good afternoon, everyone. My name is Polly Pittman, and I'm the director of the Fitzhugh-Mullen Institute for Health Workforce Equity at GW, and it's my enormous pleasure to kick off our summit. We call this the Annual Health Workforce Equity Summit. This is our second in a series, affectionately termed the Mullen Summit within the Institute, among those of us who are fondly remembering Fitz in this moment. Our topic today is structural racism in health professions education. We are really excited about this program, not only because of the tremendous speakers we have lined up for you, but also because of the participation. We have almost 900 participants in this summit, including clinicians and academics and policymakers. So a nice diversity of types of professionals and activists that are interested in helping to make change in this area. We have two goals for the day. The first is to identify the institutional and structural factors in the continuum of health professions education that hinder racial equity. And secondly, and more importantly even than the first, is to articulate a comprehensive strategy that engages a broad base of actors in the effort to deconstruct these factors. So we want to put the emphasis on the positive and on the areas of action that we can affect going forward. So just a few remarks about the background. Obviously, this topic is very important in the year 2020, not only because of the devastating disparities that we're witnessing in the spread of the COVID-19 pandemic, and in particular in terms of mortality, as well as the tremendous surge of indignation and activism that we've seen in this country as a result of the loss of Black lives at the hands of police. But in addition, this is actually a topic that the Mullen Institute has worked on for a long time. For those of you who knew the late Fitzhugh-Mullen, he described himself as a civil rights doctor. He had a tremendously transformative summer in the year 1965 when he went to Mississippi and essentially offered his medical knowledge at the service of social justice along with other types of activists. And throughout his long and extraordinary career, this has really been at the core of what he believes medicine should do. He, in the year 2010, together with our colleague in the Institute, Dr. Candice Chen, and colleagues from the Graham Center, developed a ranking of medical schools according to what he called social mission. And he published that paper in 2010 and essentially turned the world of medical education upside down in terms of who was who. The very most quote unquote prestigious schools turned out to not do so well in terms of social ranking. And some of the smaller and state-based schools did quite well. That paper was really, I think, a turning point in the conversation around health professions education. And since then, Fitz developed a number of projects in this area that continue today. I want to mention four in particular. One is an instrument that he and his colleagues, including Sonal Batra, who will be speaking later today, developed around social mission metrics and the idea that schools could self-assess social mission metrics. So the instrument looks at everything from curriculum to extracurricular activities, global health, a school's mission statement, community collaboration, student and faculty activism, student and faculty diversity, pipeline programs, student clinics, participation in primary care, and the focus of research. So this has been an area of work that has continued today. It's now expanded to nursing and to dentistry as well. The second major area of the Institute work that relates to this topic is the Beyond Flexner Alliance, and you'll be hearing more about the Beyond Flexner Alliance. They also are co-sponsoring this event. I think Fitz's conceptualization of the BFA, as we call it, was that it was really a social movement. It was a social movement of educators and students that were committed to social mission. The third project is a relatively new project that has had tremendous impact. It's called the Atlantic Fellows for Health Equity, supported by the Atlantic Philanthropies and led by Dr. Gwen Burke. The purpose of this program is to train health workforce equity leaders and to give them the tools that they need to be able to maximize their impact on this and other equity issues. And lastly, a newcomer to the slate of projects related to this topic is something that we call a diversity tracker. Ed Salzberg and Maria Portela and Toyoshi Ojejemi are leading this project. It's funded by the California Endowment and the Macy Foundation, and you'll be hearing a little about that project later on this afternoon from Maria. But essentially, they're trying to make the data on diversity in the workforce more transparent so that it can be used to make institutions more accountable in this area. So today we're going to begin with a keynote that is going to give us a big picture on race and access to higher education. And then we have three panels. The first will look at educational pathways, or what are sometimes called articulation agreements. The second will look at the experience of students and faculty of color in health professions school. And the third will focus in on the policy changes that are needed to promote equity. And we will close with a discussion of what can be done, what can be actionable, again, with the idea that this should be a broad-based coalition and a comprehensive strategy. So to that effect, we thought it would be helpful to offer a sort of preliminary framework that would situate some of these issues for our discussion. And again, this is really a straw man. It's meant to simply stimulate conversation and by no means be a final framework. One of the things that we realized as we were thinking about the diversity issue is that in many ways it's not an end in of itself. It really needs to contribute to racial and ethnic equity. But the ultimate goal is racial and ethnic equity. And by the way, that's not just removing disparities. But of course, diversity and even inclusion of the workforce is not enough. You also need to remove structural biases in practice among all health professionals in their workplace and in their practice. But what we are really going to focus on today is what the educational inputs are into this framework. So first of all, we're thinking about a continuum of education. It's not just health professions education or even graduate education. It's actually starting in primary school, perhaps even before. So it's the whole sort of history of education and the advancement of education and access to that continuum. We've identified 5 areas that are reflected in our program today where we think there are important factors that are indeed structural. So one is, as we will be talking about in the first panel, what we call educational pathways. So they're programs and policies that encourage advancement. The second is funding, and that's both sort of historic funding for big areas of our system like NIH research funding or graduate medical education funding, as well as funding for new programs or programs that are specifically focused on diversity. So funding in general. Social mission of health professions education, which as we spoke about a minute ago, is really the whole set of measurable activities and attitudes at the health professional education level. Regulations, which might include things like the content of licensure tests, the content of accreditation instruments, which we'll also be talking about, I think, in our third panel. And then lastly, legal action. And I don't mean to reduce it to affirmative action, but obviously that is a prime example of the kinds of legal actions that are related to the continuum of education. So essentially, this circle is sort of what we will be focusing on today for the most part. So I'd like to, before I move on to introducing our keynote speaker, say thank you to several people, in particular our co-sponsors, Beyond Flexner Alliance and the GW School of Medicine and Health Sciences Anti-Racism Coalition, to our funders, in particular Peter Darrow and Jeff Cohen, who are childhood friends of Fitz's, and dozens of other people, many of you perhaps on our call today, that have contributed to the Mullen Legacy Fund. So the Mullen Legacy Fund is essentially sponsoring this event. In-house, we had many people working on this. I particularly want to thank Ed Salzberg, Maria Portela, Toyoshi Ojejemi, Candice Chen, Sarah Westergaard, Julie Orban, Shalini Rashur, Emily Bass and Kate Green, Chelsea Richwine, Beza Gebru, Noah Westfall, and Parag Patel. And lastly, thank you to you all. We have almost 900 people registered for the event. Just a few housekeeping notes. We're going to use the Q&A feature to ask questions for panelists. Questions that are not answered will be posted at the Mullen Institute website. If you can tweet about the event, that's terrific. You can see our tag here. We will be taking 2 breaks, one after the first panel and one after the second. And if you leave, you can rejoin at any time using the same link. We plan to follow up with you all, both with a report on the survey, on the summit, and possibly a survey that will help us prioritize areas of action. And we hope to then present all of that again in a follow-up to this summit in December, possibly with a smaller group of people interested in really moving forward with a plan of action.